CGMs and pumps have been, it's just been very interesting to sort of watch the improvement in technology in both of these things. And it was timely because when the pandemic started, patients who weren't necessarily able to leave their homes, we were able to still pull all their data, remotely from, their continuous glucose monitoring platforms. And so it was very, very seamless to be able to virtually monitor our patients. Or even now, we have actually much more precise data for blood sugars, but also if someone's, having issues with their pump, or blood sugars are up and down, then we can easily pull data and make changes, and we can make changes in a much more confident manner rather than someone pricking their finger once a day and then guessing kind of what medication changes would change what. And so I think it has put patients more in charge of their health because they're able to actively monitor, and obviously they can dose more appropriately for meals and things like that. But also for the medical team, we're able to also help our patients better because we have much better data. So all in all, I think diabetes technology has made leaps and bounds in terms of advancement. The biggest area of research, and this kind of overlaps with weight management and type 2 diabetes, is all the GLP-1 development. And so a lot of it right now is focused more on weight management, but the studies prior to that were all, diabetes related. And so we're seeing a lot of long-term benefit, heart benefit, kidney benefit, from use of these medications. And, there's also new agents in like the kidney world to help slow down, progressive kidney disease as well. And so I think, it's important to make sure that we're staying up to date with just the new developments. I think there's a lot of stigma right now involved around GLP-1 usage and discomfort potentially in prescribing various medications as well. So I think it's really important to make sure that we are accessing evidence-based information and accessing those who are comfortable with prescribing and understanding how to prescribe appropriately. And so with the long-term benefit, it's amazing how many, counter arguments you'll hear from patients saying like, oh, well, I've heard terrible things about this, or, like people feel terrible on it, or like the side effects are very dangerous. And I think it's really important to make sure that we are staying as evidence-based as possible, because, the things that our patients are reading, as we all know, are potentially, skewed because the people who are feeling the worst are the ones posting on like online forums and those kinds of things. And I think also the news tends to be sensationalized around side effect profiles and things of medications as well. And so I think, it's really, really just, especially in this environment where social media has taken such an impact in like the weight management world and within GLP-1 usage, that we are accessing appropriate information and data. Clinical trials help us understand medicine better, right? Or understand our specialties better. And so I think it's really important to make sure that we understand how to interpret clinical trials and especially understanding like long-term, how will this affect the patient that you're treating? Is this patient a good candidate for this treatment? And what are we seeing, right? So I think, it's really important to make sure that we are accessing like randomized controlled data, making sure that it's a sound study. And I do think that it is important to understand what other practitioners are doing in your realm. It's tough to just sort of like be on your own and not necessarily discussing challenging cases. So I think it is really, really important to make sure that we are collaborating with our colleagues because that's how we learn. And so there's so many studies out there. Obviously, there have been some significant landmark studies in the world of diabetes, but now we're expanding to cardiometabolic care because treating diabetes and obesity means that patients' heart disease risk goes lower. And so what are we doing to like mitigate those risks? And so it's become sort of like a interdisciplinary specialty at this point because it affects everybody. And so, I mean, just like, the SGLT2 inhibitors, we obviously started using those about a decade or a little bit longer ago for the management of type 2 diabetes, but now we're seeing renal benefit, we're seeing cardiac benefit. And it takes a little bit longer for other specialties to catch on when one thing's been used for one thing for so long. But now we're seeing like even GLP-1 medications are starting to be used in the world of cardiology and nephrology. And, so it is really important to make sure that we are staying up to date with the data. Especially in the world of like Google and social media, because, patients are coming in with a lot of information, obviously saying like, well, I read, such and such. And so we have to be able to make sure that we're countering that with appropriate evidence-based information.